Hello friends, myself Dr. Sudarshan Gore, working as a dental surgeon in last 15 years in my Gore Dental Hospital, Maliwada, Ahmednagar, Maharashtra. In this series we are going to take information about different subject of dental care. Today our subject is which cap you have to choose between three of caps. Means there are three options that we can choose the caps or crown or dental crown for the dental treatment. First we are going to see why there is use or why we should fix the cap for the tooth. There are different reasons that we should get cap done for the tooth. The first reason is when the anterior tooth or your smiling tooth are fractured or broken. If you have got some accident, in that accident the trauma to the jaw and trauma to the teeth occurred. In these cases the tooth get fractured and it doesn't look nice, so your smile get hampered and you have to get done the crown of the tooth. Secondly, after 5 years or 10 years of the fracture of the tooth get blackish or yellowish. So you get that tooth crown done or cap done, so it will look like of adjacent tooth. After that, many a times there is a spacing or space between the upper teeth or anterior teeth, so you can use the cap to close that space in the upper tooth. After that, many a times the anterior tooth are fractured or it is broken, so in these cases you should use the cap. Secondly, in the last molars or in the molars or in the posterior teeth, when tooth are abraded, or if the tooth are vanished, so you can use the cap to function your chewing function properly. If there is caries to the tooth and but there is no pain, so in this case you can also fix the cap to the tooth. After that, if there is food lodgement, means if there is food lodgement in between the two tooth of the posterior tooth, so in this case you can also use this crown treatment or cap treatment. And lastly, if you have undergone the root canal treatment, what happens in the root canal treatment? The tooth get hollow inside, because we remove the part of the tooth that is caries, and pulp of the tooth means that is the sensory part of the tooth. The tooth strength is lost, so to regain the tooth strength you have to get compulsorily fix that crown or cap. So these are the uses of the fixation of the cap. Now we are going to see what are the options available for the caps. There are three options for the caps. First is metal cap, or second is the ceramic cap, or third is the metal free cap. In each cap we are going to see in the detail what are the advantages and what are the disadvantages of these caps. So first there is a metal cap. You can see there is a metal cap. It is look like metal. It is made up of, this is metal cap. It is made up of stainless steel or nickel chromium alloy. This is a metal cap. The disadvantage of that cap is if you get fixed that cap, it seems that it hampers the smile of your teeth. Means if you are talking, if you are laughing, and if you are if you are doing conversation with other person, the another person can notice that you have the metal cap, because its color is black, so you can easily notice the metal cap. So it is that disadvantage that it is not aesthetically correct, or it is black to see, and it is the black color, so This is the metal cap. The life of the metal cap is approximately 5 to 8 years. After 5 to 8 years, the cap get attrited or cap get attrited, and so you have to get it replaced after 5 to 8 years, and that is the disadvantage of this cap. The strength wise, this cap is also good. So this is the first cap, metal cap. Second cap is PFM. That is we in day-to-day work we called it as ceramic. PFM is porcelain fused to metal. Means this is the PFM or ceramic cap. Inside that there is a metal layer also, and outside there is a ceramic layer. So it is called as PFM cap. A PFM cap has two layers. Inside there is metal and outside there is a ceramic layer. So it looks like your tooth, and it doesn't hamper your aesthetics or doesn't hamper your smile, or one cannot notice that you have fixed that crown. So it is advantage of that cap is it looks like your natural tooth. So this is the most popular cap we are using right now, and many of the patients are using this cap. Approximately the age of this cap, or the time that this cap can go along is approximately 10 to 12 years. After 10 to 12 years, it has to get replaced. So that is the second cap, PFM cap. Now we are going to see the third and most advanced technique in the cap, or advanced option in the cap. It is called as metal free. And this is the metal free cap. You can see there is no metal layer inside, so hence it is called as metal free. It is metal free cap. It is the most advanced cap, and nowadays patient asking for this metal free cap. Metal free cap made up of different many companies or many labs, dental labs can make this metal cap. And this metal free cap is made by computerized technique, that is CAD/CAM technology. So it is proper in the fitting, because it is made up of the computer is used to make this cap. So it is called as CAD/CAM technology. So the another advantage of this metal free cap, that you get the warranty card of 15 years for this cap, that it can last longer than 15 years. The company or lab which make this cap provides you the warranty card of your tooth. So if the tooth get any distortion before the 15 years, you get that cap replaced by your company. So that is the most advantage of this crown, that is the metal free cap, or we can call it as CAD/CAM, or another zirconia, or 3M. Many companies, different names are there. So these are the three main types of cap that we day-to-day life we can use these caps. The fourth cap is golden cap. We used to see in the old ages, or before 20 to 15 years. There is more craze of these golden caps. Nowadays these golden caps are vanished, because there is no craze between the patients. Nowadays there is a craze of natural looking tooth, or natural looking crown or cap. So these golden cap get vanished. So these are the three or four type of cap which we have seen the advantages or disadvantages of teeth. So you can choose any between these three caps according to your needs and your advantages and disadvantages. So these are the information about the caps or crown of the tooth which we have seen today. In the future, we also come along with many subjects of the dental care or dental fraternity subject. We are going to look in the most needed subject in the future. Thank you for watching, and if you feel that this information or this video is important for you, Please subscribe my channel and please share this video to the more of the people. Thank you.